Hey, Cut the Shit listeners. You can find every episode on Apple Podcasts, Spotify, or YouTube. Go check us out. Welcome back, everybody. You're listening to Cut the Shit, a podcast series that aims to take a closer look at the impact of the IT industry, both the good and the bad. Cut the Shit is brought to you by Plow Networks, a managed IT services company based just outside Nashville, Tennessee. I'm Bryan Link, COO here at Plow, and I'll be your host for this series. I'll ask questions, and with the help of our guests, try to dig deep on some of the key challenges we all face dealing with IT. So with that, let's cut the shit and get started. On today's episode, I'm very excited to have Kyle Duke as our guest. For the past almost 4 years, Kyle has served as the CIO of EvidenceCare, a clinical decision support platform that helps doctors optimize workflows directly in their EHR systems. Prior to joining EC, Kyle had spent the better part of 2 decades in technology roles within a variety of healthcare companies, from startups all the way up to large enterprises. Kyle has a really interesting mix of business and technology in his training and experience. So we spend time talking about the need for translators inside organizations, the massive and growing role that technology continues to play in healthcare, and his optimism for the future of technology-supported healthcare. I hope you enjoy my conversation with Kyle Duke. Kyle, welcome to Cut the Shit. How you doing today?
Doing great. Happy to be here.
Very good. Well, glad to have you on this warm Monday.
It's unusually warm compared to the last couple of weeks where we've been hanging out in the 20s and singles in the morning. So yeah, absolutely.
Yes,
we've got folks all over the country. Some of our northern folks, Chicago, whatever, have been making fun of us and are suffering in the single digit temperatures down here. So
yeah, my wife gave me or saw something on Instagram where it was like this was last week or whatever, when it was to your point, in the low teens in the morning, and then 30 during daytime, or 20s. It was cold for us. She was like, to all the Southerners, stay home, don't leave your house. It'll be just hang in there. To all you Northerners, time to break out your big coats. It was something like that. It was along those lines. So that pretty much nails it. So, well, listen. Thanks again for joining us. This is going to be a fun conversation, given that you and I go back a ways, and I know a little bit of your story, but I'm looking forward to hearing a little more. But before we get started, before we dive into the meat of the discussion, I always like to ask, just to kind of get the juices flowing a little. How about you give us an example of an interesting use of technology or a hack that you've seen lately? And it doesn't have to be at work. It can be, but it doesn't have to be.
Yeah, this weekend I ran across a guy that I know through my kid's school, and he was telling me about this company they just started, and it's a technology-based company and this platform that they built, and it was pretty intriguing to me. His background's in sales, and there's all kinds of uses of, point uses of AI that are starting to come into our daily lives, right? Recording your team's calls and transcribing that, little things like that. They've gone and pulled all those little point things that we use in our sort of daily business lives together into a complete sort of sales platform. And so as a salesperson, you're having the call, you're having a conversation with one or maybe many people on the other end. It's recording all this and transcribing as we're kind of used to, but then the AI piece in the background is breaking all that down. It's actually learning the personas that you're selling to. And then after the fact, it's helping the salesperson create pinpointed follow-up to each persona based on the questions they ask, the title they have. It'll go out and find what it can about them publicly. So you may be able to pull in something, individual, that's individual person. And then the AI in the background is managing kind of all of that nurturing and follow up. It's crazy sort of, how intelligent this kind of sales guidance platform is. It was pretty cool.
That is cool. And you're right. We're seeing more and more. You called it point uses, but I think it's a good phrase for, we've used sort of discrete applications, right? Or point use is better. Mine sounds dorky. I like yours better. I'm gonna stick with that. But we're seeing it, where people are finding very specific things that AI can do to help them. I mean, you mentioned a good example when, transcription and summaries off of meetings, right? That's a hassle, right? It's a pain. Somebody's got to take the notes, You have to assume the notes are comprehensive, that they didn't miss something or, went to the bathroom or whatever. And then summarize those. Now there's a perspective there. Is that right or wrong? Whatever. But man, it saves a lot of time. And we've found, like you guys have, that those are generally pretty well done. I mean, they've gotten really, I mean, again, if it's language based, I mean, we talk about AI and I think we lose our sort of perspective on what it is, right? These are large language models. So they're really good at language, right?
That's right.
Really good at reading, digesting, and then putting things together, sort of guessing what the next things ought to be said, right? That's kind of how it works. It's way more sophisticated than that, but conceptually is how it works. So yes, you're right. And we're seeing it like you just, or like we were talking about teams and transcription summaries. We've had good luck with using it for service coordination, doing intake on tickets that come through the system, and then playing traffic cop around those tickets based on rules and capability, who's available, who's working, whose queue is smaller than someone else's, right? And I can see all kinds of applications of that in call centers and variety of places, right? And frankly, it's not really disrupting somebody's job necessarily. You might have had a service coordinator doing that. Usually what it was is just weren't doing a very good job with it. Right?
That's right.
It wasn't getting done very well. So it should be better now, right? So it should be an improvement in service quality with a pretty minimal increase in costs. I mean, de minimis in most cases.
Yeah, absolutely. And I think, where we're seeing it, we're in the healthcare space. So it's definitely been the buzzword of, it was the buzzwords of 2024 for sure. And, most every health system that we've come across is tinkering with something, right, in that sort of space. But to your point, it's not replacing doctors, it's not replacing nurses or anybody in the hospital, but it's definitely starting to see use cases where it's doing task, creating efficiency where those people can actually get back to doing what they were intended to do, right? One-on-one interaction with a patient, or just being a nurse and making nursing decisions and not doing paperwork, those
Right.
sort of things. So, I'm with you. I think it's, the efficiencies are incredible, and it's not replacing human people. It's just letting us as humans do the things we're good at.
Yeah, and hopefully, if it can make us more productive, right, then people can create more value over time, right? That's ultimately how, even though that sometimes creates some harsh circumstances where maybe not as many people get hired, but at the end of the day, what people want is they don't want to just get hired. They want to be able to grow they want to grow their income, right? And the way you grow your income is to create more value. I mean, that's the long and the short of it. Ultimately, all of us, whether that's as investors or workers, right? That's what we're all looking for, per unit of effort, if you will, to use that sort of expression. And I think this has a potential to create leverage there. So that's great. Thanks for sharing that. And I hope that platform works out well for your friend. That's an exciting opportunity. It sounds like.
Yeah, absolutely. Yeah, I'm looking forward to seeing where he goes with it, and I'm talking with our folks internally to see if maybe we can hop on early and
take a look at it.
Yeah.
Yeah, for sure. All right, well, let's get to the main event. To get us started, give us a quick thumbnail sketch on your background and sort of kind of how you got to where you are. You're like me, you're old, and so that could take a while. So give us the Reader's Digest version.
Yeah, absolutely. So, I've been here in Nashville, I think in February, it'll be 27 years that I moved here out of college. Almost all of that has been in healthcare technology in some way. I tried multiple times early in my career to kind of transition my way out of being a tech person or a technical guy, more into the business side of things. But I kept getting pulled back in one way or the other. So, I started out in consulting. All of our clients were healthcare clients here in town. So, got introduced to Nashville as sort of a healthcare town pretty early on, and jumped over to a client, probably a year and a half after I'd been here, and that kind of started my healthcare journey. Loved working in the healthcare space, and did every job possible, I think, on the technical side. I've done a little bit of it all, from networking, data centers, managed servers, managed applications, all the sort of technical things. At some point along that early part of my career, I did. And then along the way, had the opportunity to jump into a startup. That was probably about 2007. It was a healthcare finance kind of startup, and I had gone back to school and gotten an MBA, and my wife had gone to get her doctorate, so I'd also gone back and gone through an accounting program. So this sort of healthcare finance technology platform was
a marriage of the two, right?
yeah, it was like the sweet spot. And so excited about that. Great opportunity. We had the first year we were humming. It was fun. I was learning a lot, enjoying it. 2008, if you're old enough to remember, the economy pretty much just nosedived in 2008, so the startup really didn't make it through that. But I kind of had the that sort of planted a seed, I guess, if you will. Uh, After that, I worked for a company called HealthSpring for 6 years. We got bought by Cigna along the way. Was the CIO for TennCare, our Medicaid program, for a couple of years, and then had an opportunity to kind of go back into the startup world. And so my last three stops have been early stage healthcare technology companies, and I've really enjoyed kind of that part of my career.
Well, so with that in mind, tell us about, give us kind of the elevator pitch on EvidenceCare. And I know you've got an interesting story about how you got on board. And I mean, like many stories in Nashville, it started from relationships prior to, as they almost always do, right? But give us a little story on EvidenceCare. Let's hear about that. Let's hear its origin story.
Yeah, so EvidenceCare is a clinical decision support platform, kind of high level, if you want to call it that. The company's been around 8 or 9 years. The original version of the company, the founders had an idea to take all this clinical content and put it in the hands of physicians. And 8 or 9 years ago, that was sort of through a web portal. And they had pretty good uptake on sales of that. A lot of health systems bought it. What they didn't have great uptake was the physicians actually wanting to pop over into yet another solution and look for content. But they did have one of their health system partners said, this hadn't gone over incredibly well for our physicians, but we do have a need that maybe you guys could help us with. And that was actually taking a very specific piece of content that they knew their physicians needed and would benefit from, and it would benefit the health system. And they said, could you find a way to take this content and get it embedded into our Epic system so that the physician has access to it
right there
in their workflow, right?
In the same pane of glass, so to speak.
That's right. And so they took that challenge on, and really that's kind of what the company took off on, is integrating into Epic, Cerner, Meditech, figuring out how to not be the owners and curators of all the content, but to take whatever content physicians needed, and enabling that in their workflow. And so that's really kind of taken off. The last 4 years, the company has seen 100% growth year over year. I think we're in 25 plus health systems now, over 150 hospitals, somewhere in that range. So a lot of growth, and that's really caught on as to sort of being the experts in getting clinical content in a usable fashion into the physician's workflow.
Good deal. And so, when did you get involved in EvidenceCare? Sort of what point along the way?
Yeah, I've been here a little over 4 years. One of the things they did right after COVID hit, kind of threw us all for a little bit of a loop, right? And the company was sort of evaluating where they were.
Was it still on the kind of the subscription model before, around sort of the content?
They had just sort of pivoted, kind of pre-COVID, kind of the middle to end
just
of
kind of getting going with this embedded EHR model.
That's right. Yeah, that's where they were. They had figured out, I think they had at that point kind of nicked the old model, and that this was the new model they were going to chase. And they were raising some funds. And then through that process, they got to know Bo Bartholomew, who, if you're healthcare in Nashville, everybody knows Bo. And so he somehow got him, in their conversations about raising capital. And through that, to make a long story short, he ended up being hired as their CEO at the time. And so Bo and I had started working on another company. I've known Bo since right after I moved to Nashville. Interesting story. Bo and I were both college athletes. He played football at Davidson. I played at Maryville College, and we actually played against each other for 3 years. And then shortly after I moved to Nashville, somehow we got introduced and kind of made that connection. So
told some more stories.
yeah, trade no war stories, and so Bo and I have known each other a long time. Had not really ever had an opportunity to work directly with each other, but when we were at HealthSpring, his company had done some work for us, and we had stayed in touch. So he and I had both rolled out of companies early 2020 into 2019, January 2020, and had this platform that a physician had, he had dreamed up this platform. He had found a couple of tech guys that were willing to try to build this thing for him. He had kind of built the beta model and got some companies or some hospitals actually to use the platform, and the thing worked. It worked pretty well, created some good results, but he didn't really know how to then go take that and grow it into a company. So
right.
Bo and I got pitched this idea, and knew the physician well, knew the tech guys who had built it, sort of poked around on it and thought, there's really something here that we can go build something on. So I think I became an employee. I think it was February 26, 2020. So, I became a
right
full-time
before
employee.
the world shut down.
I became a full-time employee of this great venture that was going to take off, and then the world shut down, and and it's like, what are we doing here? So again, we're trying to figure this out through 2020. Bo gets this other opportunity over here at EvidenceCare and runs with that. And he's still trying to help me, get our idea up and off the ground. And we did pick up a little steam towards the end of the year, signed our first customer. Early 2021, we onboarded our first customer and had started to build a team. And really, we're starting to find our footing. The platform that we had is really complementary to the tools that EvidenceCare already had. We had some common investors. It's a Nashville story for sure,
yes,
right?
Yes.
The Nashville who's who, of tech investing were invested in both companies. And so early 2021 made the decision that we were going to sell our platform over to EvidenceCare. And so through that transition, I came on. Bo said, I think there's a role for you here at the bigger company. And so I came over once we made that transaction in early 21.
Gotcha. Well, it's a good story, and congratulations. I mean, you never know how that's going to work out, and to have landed, in an area where you've got a little momentum and some, you're past that initial, because getting first past the first phase that's the hardest part, right? Is getting that first turn on the flywheel to get the thing going is unless you've ever done it, you have no idea what a pain it is.
That's right. And through looking back through my career, I've been part of companies that bought other companies, or a company that got acquired. I've seen all that. I've seen partnerships. A lot of times those things are just so difficult, and sometimes they work, sometimes they don't. It feels like most of my history, they were never exactly ended up being what you thought it was going to be, right? In the case of this one, it's been really good. If you look at where our company was when we sold to EvidenceCare, we are way further along than we would have ever been on our own. And I think we also helped EvidenceCare sort of take a step forward that they would have gotten there, but probably not at the pace that they did. So it's been a really good, marriage of 1 + 1 is really more 3 than 2. I mean, there was definitely a benefit to both companies in combining, for sure.
And that's hard too, because acquisitions have a reputation for sometimes in the best of circumstances being 1+1 is 2, and oftentimes being less than 2.
That's right.
And being somewhat destructive in terms of value for lots of different reasons. It might not be technology, it could be personalities. There's a lot of reasons for that, but that's for another podcast.
That's right.
So you've been there for a bit. You've got this sort of interesting background where you've got a solid technical background, but you've also got this strong set of business skills that you've cultivated and been in a variety of different sort of environments, both, from the, startup pre-revenue, nothing but, an idea, or doctor, mad scientist doctor, and a couple of, and some lines of code, up to, big companies. So I'm curious, let's talk a little bit about core IT inside healthcare, because one thing's important to realize: the listeners to this podcast are not all healthcare people. Some are and some are not, right? Our clients, we serve, like almost everybody else in Nashville. You can't avoid healthcare. We don't want to avoid it, but we're not a healthcare specific provider. Some of our best clients are healthcare clients, and it's in the water you swim in Nashville for sure, but it's not it. So I'd like to sort of broaden the perspective and see if we can draw some lessons or some insights from you that might really transcend healthcare and go beyond. Cause I think it speaks to IT. Maybe one of its problems is its universality, right? That there are common needs for technology across whatever type of company you have. That also leads to the perspective of commoditization and it's a utility and it's just, who cares? It's just a cost or whatever. We'll get to some of that. But so you've been around a while looking at these larger companies. What are some of the core technology problems that you've been experiencing at the companies you've worked at, or if ones you're aware of, but you've just been lucky and had to deal with them? Like, what are some of those? I mean, give us 2 or 3, especially the last 5 years, that really feel like, and they're core problems because they're not easily solved. I mean, if they were easily solved, we wouldn't be talking about them.
Yeah, it's a phenomenal question. One of the things I think we're finally starting to, get over the hump on a lot of it. I was right in the throes, if you look at some of the roles I've had, of this whole idea of cloud coming to fruition. That cloud as we kind of know it today, AWS environments, those sort of things. I remember when that first started taking off, and for a lot of good reasons, it made a lot of good sense. But as healthcare tends to be a slow adopter of most every technology that comes out, core technology, they were not getting on board. They were not doing it. A lot of times you'd hear these, security arguments for why we weren't going to do it.
Right.
So many things like that.
I would assume regulatory got thrown around, because it's been my experience that if you're in a regulated industry, if you don't like something, you could always threaten, regulation's always a good way to threaten a new idea to shut it down. Right. So
absolutely. Yeah. How is our data going to be more secure, in this cloud environment than we can do here, in our own environment? But over time, those arguments, they just didn't hold up, right? I mean, it's like XYZ healthcare company that's trying to stretch every dollar. I can promise you're not going to outspend AWS on building the secure environment. You're just not going to do it, right? It's right. But so over time, that's been a big shift and transition. I know there's still a lot of healthcare companies and customers of ours that still have big data centers and lots of people out there running them, right?
There's lots of data centers, and there's lots of on-prem infrastructure still running,
absolutely.
Right? And it's not because it's an AS400. I mean, some of it is just, it's still there, and, it's working, and the people there are comfortable with it and they don't want to change, right?
That's right. So that's, but I do feel like it's a lot more accepted. Our platform is a 100% SaaS platform. So we're hosting that in our SaaS environment. It's integrating into their EMR, wherever that may be, on-prem or in the cloud. But, the ability now to have these, different technologies and functionalities that you can bring to play in a cloud environment, and that just healthcare fought that so much. So,
and I want to stop you there because I want to ask about that, because I think when like you, I've sort of watched this evolve over the past, we'll say 15 years, right? Because I remember the first time I heard about true multi-tenant environments, outside of data center sort of based things was probably late 2000s was when people, sort of started talking about it, right? AWS was picking up steam, but it was still seen as, that's something you could do for consumer apps, but not really it wasn't serious, like along the lines of what you're talking about. But it quickly changed. And the way I remember it changing was because all of these folks were doing a great job selling cloud because it was going to save people a lot of money. And I'm not so sure that's actually happened, frankly. I actually don't think, I mean, there are cases where I think being in the cloud has saved people money. I think there are other cases where it's actually been more expensive for a variety of reasons. But it feels to me that the value proposition, and I'm curious to get your perspective on it, is what you just described, which is, I'll use, for lack of a better term, portability, extensibility, and integration potential, which allows you to move faster, to be more innovative and to develop products more quickly, as opposed to, well, the data center cost X and the cloud is X minus, so we should go to the cloud, which I felt like was the initial that felt like the initial sort of logic that was being sold. And maybe that's just because that was how else were you going to sell it? They didn't know what else it could do.
Yeah. No, interesting point you make on the cost thing. Cause that was the whole, sort of first pitch, right? Is it's going to be so much cheaper. Some, like you said, some it has, some maybe it hasn't. I will say, I think that's gotten better. The first couple of companies I worked with where we were going into cloud, the initial, you had these teams of infrastructure people who all they knew was how to run your internal infrastructure. And you think about when we used to build all these internal infrastructure, you didn't build just what you needed, right?
You were like, not.
Where are we
fixed all steps, so we had to try to anticipate because it was you couldn't just add capacity like that.
That's right. It's going to be all this effort. So let's think about the capacity needs for the next 2 years, 5 years. And so you would build all this extra capacity.
It was like buying office space, right? I mean,
and we would sit there and watch like our capacity, and you wanted to keep this huge buffer for growth. And the first few times that I was part of a company where we kind of were making this shift to cloud infrastructure, it was the same guys, right, who were designing and building out, and they would design it and build it that way, which that doesn't make any sense at all, right? No. To have all this unused capacity sitting there.
Right.
So
you went from fixed cost to variable cost, to sort of that, that model, and it was a different, philosophically, totally new world.
And so you did that, and then you had all these CFOs going like, what the heck? This isn't saving us any money. This is more expensive. So right. I think once we figured out how to manage it better, it has gotten better. But yeah, to your point, that was the original sort of selling point. But yeah, I mean, the way that you're able to just innovate so quickly and build products so quickly and expose it to so many different environments and connect different environments, I think that is bringing far more value than saving a couple of dollars on
I would agree.
Servers. So yeah,
I would definitely agree. I mentioned it earlier, but just to kind of, since we were talking a little bit about cost, and I know you've experienced this during your career, but I'd like to kind of hear you expound upon it. And that's, have you had to deal with, or maybe you agree with it? If that's true, that's fine. Let's talk about that some too. But this idea, what I'll call it, sort of, well, IT is just a cost center or utility, this perspective, right? And that's a perspective that's widely shared. It's not controversial to say that. That doesn't mean it's right, and doesn't mean it's wrong either, right? It might be partially right and partially wrong, but given the roles that you've had, what have you done, or have you heard? What have you heard others do to try to deal with that perception if it's inside your own organization? Because it can, to my point, it could be a healthy perspective on certain things, but could also cause a lot of problems if it's what I'd call sort of a simplistic view.
Yeah, I think maybe one approach to how I'll talk about that question is thinking about my career a little bit. Started out in a very technical path, right? And early in my career, then when I started sort of maybe moving up and being in manager roles and sort of at least had vision to that CIO role, right? But I remember those first few companies, IT was in such a box. And it was you had the CIO and his team, and they were over here on the side. And like you said, it was a cost center. We have to have this, but it was almost like it was segregated from the whole rest of the operations of the company, right? And typically those people were very technical thinking, and a lot of arguments between them and the CFO trying to justify spend and all that. And I really where I started seeing a lot of evolution of that is when, most CIOs I know today, they truly are business people, right? They may have come up through the technology ranks, and they're good at understanding and connecting the dots between technology and the business. But I mean, they're business people today, and they do sit at the table. Um, Companies couldn't function without it. And so as I think companies started to realize it wasn't a, I don't know how to explain. It wasn't this. It wasn't a just like, hey, this is a necessary thing. This is like we don't have a company without this.
Right.
Like none of these departments exist anymore without the platforms that make them run. And so, as the CIO role became more important, more of a business role, more integrated into the C-suite, I've just felt like I've seen that division erode a lot
Right.
more. And people just think of it now, your technology department, whatever we call it, right? We've called it everything. We tried the renaming and labeling over time to try to make it better. It was business technology, it was IT, it was, all these different titles. I mean, today it's just pretty much integrated to most businesses. And then the interesting thing about, now that I'm actually at a company where um, not working in a company like a health insurer where the technology is one of the
It's a facilitator of the delivery, whereas
facilitator of the
you
company.
you are at a true technology company, not a technology enabled company.
Exactly. That's a little different
Right.
beast, just because your whole purpose is to create technology and push
Right.
it out. So, I've kind of enjoyed that. The last two or three stops have sort of been those types of companies, and I um, enjoy that a little more. I don't have quite the same uh, friction, which, like I said, has gotten way better from what I remember 20 years ago. But I'm sure if you're in some of those other companies, there's still some friction there between the
Oh,
CIO and the CFO for
there is,
sure.
there is, and of course, that some of that is just the nature of the right the trade off world that a CFO lives in that context relative to I mean it's like the old guns and butter, right? What do you want to spend it on, right? We've got fixed resources and we've got more demands. How do we prioritize those, right? And that becomes, I use the word political, not in a negative way, but that becomes a political discussion at that point. Those are about trade-offs and deciding, which way do we want to go as a business? Does the technology get us there? Does the marketing get us there? Does the operational, investment, et cetera? Do me a favor if you don't mind, and give us a quick sense of what are the areas of responsibility that you have today as a CIO at EvidenceCare, and maybe contrast that with like patient focus, or maybe go up, maybe I don't know, maybe 10 care, maybe something pretty dramatic. I'm curious to hear what that range of coverage or range of responsibility looks like.
Yeah, it's different. When I was at TeamCare, very traditional CIO type
That's
role
what I figured.
where, infrastructure. Now, that was maybe slightly different because TeamCare is part of a bigger state organization. And so I did rely on partners at the state for some infrastructure and that sort of thing. We used the state's data centers and that sort of thing. But all the applications that were part of TeamCare, both for our internal people or for members, all of those application teams, think, developers, engineers, operators, all of those things, very traditional kind of
So
CIO
there wasn't a
role.
distinct CTO role at TenCare where the development function might roll up to.
There was not. It was all things technology. I was the owner of that in some form or fashion. Security, compliance, applications, data, and how we were using data, business intelligence wise. So a lot of those functions were, part of a pretty traditional CIO type role.
Right.
I joke here in this role that I'm in now that I'm a CIO for a company that doesn't really need a CIO. And the reason I say that is a lot of those traditional things don't necessarily apply here. We have, because we're really building technology, we have a CTO. He's focused, he owns all the engineering and product teams, and they're doing all the actual building.
Right.
And quite frankly, they manage and own most of that, AWS or whatever platform it may be, infrastructure as well. I do anything internal facing, I would own and manage that or oversee that. Think of your back office applications and technology stack, the office itself, any infrastructure, which we don't have a ton. We're mostly a remote company, but we do have a little office. Security and compliance.
I was going to say, I would assume security and compliance is probably the biggest, or at least the one that could get you in the news the easiest, right?
That's right. Yeah. And that's a big chunk of where I spend my time and effort. I give the company credit. When I came on, we were still a very young, pretty small organization. And we decided, hey, we're going to get HITRUST certified. That's kind of where this industry's going. It's going to be an expectation for a company like ours. It's going to assume a lot of customers' data and process it and hold it. So we're going to get HITRUST certified. And it was a big lift for a company our size at the time. But we were able to do it, and we just kind of set that mindset that that's not a nice thing to have. Having that sort of security and compliance program is not a nice thing to have. It's a requirement to play in this space. So it does get a lot of time and effort. And then, beyond that, if you look at my background, having been in several early stage companies, I've been a part of capital raising, or I've been acquired. I've been part of doing acquisitions. Anything in that realm, I typically help Bo. If it's due diligence, that sort of thing, that's falling on my plate. And then some strategy. The board asked us last year to be a little more deliberate on being, strategic. And we had gone through this crazy 2 years of growth. We had implementations going out our ears, right? And we did a really good job at executing that, blocking and tackling, which we needed to do. But the board helped us to see, the next phase of growth is coming. So make sure you got to get ready, putting some effort on strategy. So I spent a lot of 2024 also doing some strategic exercises, helping lead strategic exercises. Our whole C-suite's involved, and we all need to be thinking strategically. But my role was just kind of help us pull back from some of that blocking and tackling, and spend the right amount of time really focused on doing some strategy work for this upcoming year.
That makes sense. All right, so couple questions before we wrap up. This one's a little bit backward looking, but I think it's kind of a fun question. And you've been in the game a while. What are some of the most satisfying changes you've seen in IT, or kind of in some of the situations you've been in over the past 5 or 10 years? And maybe pick one or two and tell us why they were satisfying.
Well, definitely. We talked a little bit already about the kind of the evolution of IT, if you will, and the perception of that.
That feels like that's played into strengths for you, right? Given some of that fluency in business.
Yeah, and I mentioned early on in my career, I tried everything to get out of technology. With some of the education I did, some of the postgraduate stuff I did, and tried really hard to sort of push over in other parts of companies. And part of why I've been drawn to small companies, because you do wear a lot of hats and you are exposed to a lot of that stuff. But that's also just where technology has gone, as we've mentioned. And so that's really played into my strength of a couple of stops I've been, my title's actually been COO, Chief Operating Officer. And I owned just all types of operations, because most really good CIOs they're really good operators. They're just operating with a technology focus.
Right.
So as you know, as that world has changed and evolved, and technology's become more integrated and into the companies, that's just kind of, I mean, that's just kind of hit my sweet spot,
Right.
and put my skill set, I guess, as a valuable skill set, for sure.
Okay, let's go the other direction. What's been frustrating over this same time frame that if you had a magic wand you'd change it, but we don't. So it's just something you've had to deal with as it relates to dealing with technology.
This isn't necessarily one specific thing. I'll give you a specific example or two that frustrates me sometimes, being, truly a tech guy, in some sense. One of the things we love to do in technology is take something that's not necessarily new, something that's actually been being done, frame it in a new way, because maybe there's a little bit of advancement in that technology or whatever, and pitch it as it's something completely different that's never happened before, and get everybody so excited about it, and it becomes the buzzword of the year, and your CEO spends the whole year like beating you up on like, why aren't we doing this thing? And I'm just like, this isn't new. We've been doing this. It's just, we've just called it something different. And now you guys are all going crazy for it. That, I mean, a lot of these concepts around AI, I mean, large language models and that sort of thing are all, but a lot of what we're calling AI is really just really good analytics.
Yeah, right. I was gonna say, actually, some of it too. I was like, this is just code. Like,
That's right.
we're just doing if-then statements, guys. Like we didn't need to call it something fancy. I mean, maybe we did to get somebody to say it's okay to do it, but it's not new,
And it's I've learned that a lot of folks are basically doing, they're not maybe doing the cutting edge stuff that everybody thinks is going on, right? They're just doing what we've been doing for the last 10 years, and they're doing it really well and calling it AI, and hey, it works. But
Yeah. I mean, I'm with you. I kind of felt the same way when the cloud first started to come about. It's different now, but when it first started to come about, I worked in the financial services for a long time, and there was an old service bureau model for core processing that banks and credit unions used as far back as the 80s and 90s. And when I started hearing about the cloud, I was like, wait a minute, that's just a service bureau, isn't it, guys? And I'd said that to somebody, and they're like, yeah, but it sounds a lot better as the cloud. I said, oh, it sounds amazing. Whoever came up with that, 2 thumbs up. But yeah, okay, great. I get it. But I guess, this is probably true in all industries, right? What's new is old, and there isn't that much new under the sun, I guess, when it comes down to it. So
2024 seemed to be the year of AI for healthcare, especially hospitals. So, we sell our products to hospitals. We talk to hospitals all the time.
And let me interrupt you, Kyle, real quick, because I heard from a couple of hospital folks we were having conversations with. This has been back last summer. And this guy, he was a CFO, and he made some statements about profitability of hospitals and how much hospitals were struggling. And he wasn't talking about his hospital; he was talking about it in general. And I'll be honest, I wasn't aware of that. Is that something that you guys have been seeing, or is that a broad brush statement that it depends?
I would say that the almost 2 years, 24 months or so, right coming out of COVID, almost every hospital had negative margins. Okay. Most hospitals run small, thin margins anyway.
Yeah, they're not highly profitable enterprises anyway, right?
They were all running. There was a year and a half, 2 years there. Pretty much, they were all running negative margins. It was, one of the things that led to a couple of years of really good growth for us, because our products were bringing an ROI of either helping them generate more revenue or reducing costs to help that margin improve.
So they were intensely interested in things that could help them adjust that margin.
Right. Absolutely. Absolutely. I will say what I've seen maybe the last 12 months, and seems to be the trend we're in now, is it's become this interesting area of the haves and the have-nots. The biggest, most well-run health systems, their margins have gotten back to where they were and then some. Like they're really blowing and going. They're going through the roof. I mean, they're seeing all kinds of growth. The ones that aren't run as well, maybe aren't leveraged as well, don't have the capital support or structure, their margins continue to get worse. And it's kind of pushing in two directions, which is it's an interesting time in our our industry right now. You may talk to one health system and they're feeling really good, and you may talk to one who's trying to figure out how they're going to survive this year.
Right.
So it's real interesting. But AI has been all the buzz for them. I mean, to the point that so we're leveraging and we're adopting and AI is going to be a big part of our products going forward. We're using AI in some parts and components today. It's going to become more and more of our product. But, last year, if you'd have said, are you an AI company? I probably wouldn't have answered like we're an AI company. No, we're not an AI company. We're making use of AI to make our products better, to make your product better. But there were some health systems that, you would go to talk to and they would go, is this an AI platform? I go, well, not exactly like you're thinking about it. And they're like, yeah, I can't really talk to you right now. Like we've been instructed, like we have to go do AI this year. I mean, that's literally the way they were thinking about it.
Yeah.
I will say that has cooled off and they've started to realize it's understand more what it is, the use cases that are starting to show promise and also to understand like AI is not a solution for every problem. Right. There are some problems that have perfectly good, valid solutions with great ROI that is not leveraging AI. It's just leveraging really good technology that we've already got. So that's been kind of an interesting, evolution, and I'm glad to see that it's starting to level out and be level-headed some. But yeah, last year,
the frothiness, the hype was pretty much off the charts.
It was off the charts.
All right, last question before I get to, I guess, the second to last question. Last question specifically about kind of the business side. So, as you look ahead, what excites you as you think about the next, let's say, 2 to 3 years?
So as much as I bashed AI just then, but no,
well, you actually didn't bash AI. You asked the perspectives on it.
Yeah. You're right. I do think so. We've now, if you think about where our company is, so we 4 years of really good growth. We now have a good customer base. We've had customers who have gone through a complete contract. If you're contracting, say, 3-year contract, so we've experienced all that. And that is a ton of learning and feedback. And I'm super excited about where our company is because we have a good base, but the next phase of what we're going to do, we're really focused on, okay, we're creating value. How do we unlock more value and sort of supercharge this? And AI is going to be a big part of that. We'll probably have some new product later this year that we're going to be really excited about. I'm just really excited to see kind of the stage of the company we're in. We're past that. I've got an idea. We're trying to build it. We're throwing a bunch of stuff against the wall, see which parts stick, what's don't. We're past that now too. We have good working product. We have happy clients, but there's a ton more value we can go unlock. And it's just a really fun time to be in our, healthcare environment with the knowledge that we have and the platform we have to go really unlock some more value for our customers.
Got it. On the flip side, thinking about that same time horizon, what scares you?
Well, for us specifically, for me specifically, it is healthcare, and it does at times tend to, turn on a dime. Whether it's regulation, we just changed. We have a new president, we have new administration. They're going to have new thoughts on healthcare, and it's a regulated industry. So there are going to be things that we haven't thought about that are going to hit our industry probably this next 12 months as this new president and they have ideas. So just the unknown sometimes that gets thrown at you at healthcare that can just really sort of throw you a curveball and make you really shift strategy and how you sell or what your value is to your health systems, hospital clients. There's something. It's going to be something this year that gets thrown at us that we're going to have to adjust to. There always is. It's just what is that and when's it going to hit us?
That makes sense. All right. Well, that's a good one to wrap up with on the business side. So I always like to finish up with a personal question, not too personal, but a little bit personal. Tell us about something that you've read or watched lately that you think others ought to check out. And again, doesn't have to be work related.
Yeah. What would be interesting? I'll tell you something that's kind of interesting here that I think, if you're a business person, I assume most people are going to, check this out, are in some shape, form, or fashion in business. Bo is good about assigning reading material for our corporate leadership team. And we all read a book called Traction. I don't know if that's a book you're familiar with.
Yep.
Traction lays out what's called the EOS, the Entrepreneurial Operating System, which is just it's really a sort of a prescriptive way to how a leadership team operates, plans, cascades information down to their teams, all that. So we all read the book, we all bought in, and we adopted that whole Traction EOS process, which has been really, I've enjoyed it. I love the clarity of it. I think our whole team loves the clarity of it. Everybody that asks me about, hey, what's a good business book or whatever, I'm like, if you haven't read Traction, go read that. There's a bunch of really good nuggets on how to be a good operator in there.
Yeah, I've read it. It's really good. I think it's kind of like think about Rockefeller Habits or various, even going back to Great Game of Business or a variety of sort of, E-Myth. There's a variety of ones along the way, all of which provide both some, sort of taxonomy of thinking, but also to your point, some practical ways to operate, which is a lot of times the hard part. How do I day to day, week to week, month to month do things, right? To make sure to try to keep everybody on the same page, because that's always the challenge once you get more than two people in a room.
Right? If you kind of buy into the structure of it and say we're going to do this, and we're all bought in to follow kind of the plan, if you will, it just creates a consistency, right? Not only for us and how we operate and interact with each other, but for all the way down through the company. Everybody kind of knows what to expect, what our cadences are, how we're going to communicate, how we're going to operate. It's just been really good here.
Yeah, that's good. That's good. Well, Kyle, I'll let you stop there. We'll stop there and kind of let you get back to it. I really appreciate you coming on Cut the Shit. Thanks again.
Yeah, thanks for having me. Enjoyed it.
We hope you enjoyed this episode. If you were enjoying the podcast, we'd appreciate it if you would become a subscriber wherever you get your podcasts. And if you could rate and review the show on Apple Podcasts and Spotify, that would really help us out. Or you can just go old school and tell your friends, your family, your colleagues, and hell, anybody else who you think might want to hear something like this to listen in. If you're on social media, make sure to follow us on TikTok at @CutTheShitPod, all one word, where we post lots of clips from the podcast. And last but not least, you can also watch the YouTube version of the show on our YouTube channel at Plow Networks. Until next time, take care and have a great day.